9,
I think
9,
we're
10,
10.
10?
Yeah.
Episode 10, vomiting and diarrhea. Good morning. This is Heidi.
And this is Vero. And it's time for Let's Boop Snoots.
Let's boob some snoots.
Let's boop a snoots. So, on today's episode, we're going to talk about vaccines and puppy schedule for those vaccinations. So, we're going to talk about the most common vaccines, the one that are always given, and then vaccines that, depending on your lifestyle, your dog's lifestyle, that you can choose to give your dog.
And we're also going to talk about some of the more common reasons that people bring their dogs into the vet and some things that you can do to maybe mitigate those reasons at home.
Alrighty, well, let's get started. So, vaccines are pretty much separated into two categories. There's the core vaccines and the non-core vaccines. So, the core vaccines are usually for like viral infections, and they're for highly contagious illnesses. So that's why we always give those vaccines to our puppies. So when you do get your puppy, if you're getting your puppy from a breeder, they should already have their first set of vaccines, and that should be distemper and parvovirus. So we're going to talk about all these diseases and what they are and what they look like. So parvovirus, it's widespread in dogs. It damages the lining of the GI tract and can also cause inflammation to the heart muscle. So signs of that is vomiting and diarrhea, and it spreads through the doggy's feces. So when I was younger, my parents got a dog from a puppy shop. And within a day, he was coughing, he's having diarrhea, and that's what he had. He had parvovirus, and we had to put him down.
Oh,
So it's
yeah.
apparent it's a very serious disease. It can cause death in 2-3 days.
Yeah.
I don't even know like how if puppies survive this. How often they survive parvovirus.
Yeah, I don't know what the statistics on that are, but if they have it badly, and it's so hard because like reading through all of this stuff, getting ready for this episode, those are the most common symptoms that you get from your dog. It's like vomiting and diarrhea. So for like
Yeah.
everything, right?
Yes.
So, and sometimes it's just that they ate something weird, but it's especially with puppies and especially like in the beginning when you get your dog from somewhere because you don't know how they were boarded or who they were exposed to and stuff like that. I would be pretty quickly taking them to the vet if you noticed like vomiting and diarrhea that would not resolve within like a day or two.
Yes, especially they're tiny and they're very vulnerable. With parvovirus, there's often blood in the
Yeah.
stools.
Hmm.
And even if you live in an apartment building in New York City and you feel like you're not taking like it's more of an indoor dog, you just take him out for walks on sidewalks. This is carried from outside on objects and like shoes, and it's highly contagious. So you can be dragging that disease into your apartment, and your dog could be licking your shoes or the floor and get parvovirus.
Blech.
Ugh, no to
Blech.
parvovirus.
No to parvo.
Snoot to that.
Yes, I turn my snoot to parvovirus.
Another one that is part of the core vaccines is for canine distemper. And that's also highly contagious. And if your dog gets canine distemper, I feel like I'm not saying that right.
You are.
Distemper. It sounds
Distemper.
weird in
Yeah.
my sounds weird. So if your dog gets canine distemper, it's 50% of the time fatal. So it spreads through the nose and eye discharge of infected dogs. So your dog can get it from like a water bowl or food bowl that another infected dog drank or ate out of. And signs are respiratory, digestive, and nervous system signs. And I didn't know this, but if it becomes chronic and then not treated, they can get large pad disease. Have you heard of that?
No, I have not.
No? So it's called hyperkeratosis.
Hmm.
And then the pads of the paws
Hmm.
just become thicker and thicker. And they might
Crazy.
even look like hairy.
Oh.
Yeah. Yeah, I saw pictures and I was like, "Oh, seems
Hmm.
like a bit like a callus,
Yeah.
but like it grows like it's hairs."
Oh.
Yeah, weird.
Yeah.
And what else does it cause? It cause inflammation of the brain.
Ooh, that's a bad one.
Yeah.
So also like you said it's spread through like water bowls and stuff like that. Also like this is another reason why if you're getting a puppy until they have their full set of vaccines to not expose them to any other dogs or any other places, like take
Mhm.
them out on your own, and like the likelihood of like if you live in a park and stuff is probably, or if you're taking them to the park or taking them outside just on your own, is probably pretty low, but still like be knowledgeable and know what to look out for. But
Yes.
like so even if you're taking them out and exposing them to other dogs or whatever, like when you watch dogs interact with each other, there's a lot of sniffing. They're totally up in each other's snoots and boots.
Boots. Yes.
Or hoops. Both ends are they use to greet each other with. And there's like licking, there's like sniffing, and like even my two dogs, like Becky like licks Gibbon's face like constantly and stuff like that. And it's
Yes.
like depending on which dogs you're exposing them to, like you can't watch like every single interaction with them, right? Like when you're out socializing with your dog, you're socializing too, you're not necessarily watching every move that they make. And
Yeah.
so it's just better not to until they have their full set of vaccines as a puppy. I was just going to throw
Correct.
that in there.
And even some, or the next one I'm going to talk about is spread through infected urine. So even like taking your dog to the dog park or even in your front lawn, like near the sidewalk, that's where dogs urinate.
Hmm.
So you never know. Just be careful and mindful of where you're going.
Hmm.
Maybe your backyard is better.
Yeah.
But then again, like there's raccoons and squirrels and
Yeah.
who knows. So yeah, the next one that is spread by infected urine is canine hepatitis, which is also called adenovirus.
Hmm.
So signs of that is vomiting, abdominal pain, diarrhea, the usual,
Yep. The
and
huge.
coughing. It causes liver damage, eye damage, and respiratory problems. And our last one that's part of the core vaccines is rabies. So this is a required one, depending on where you live. They mandate like how often it has to be given, and we're going to talk about that later. So this affects all mammals, including humans, and it can be fatal. Signs: weakness, aggression. I thought there was another one that was spread to humans also. I think it's in the non-core vaccines.
Okay.
So those are the diseases that you need vaccinations for your puppy or dog. And then we're going to talk about the non-core vaccines. So these are the ones that you can discuss with your vet depending on your lifestyle. So let's say you like to go hiking and you think you're going to bring your dog with you, then vaccination for Lyme disease
Hmm.
might be a good idea. Or if you're going to kennel your dog, Bordetella would be a good idea. So we're going to go through these. So bordetellosis, which is also bordetella, also known as kennel cough. So
Yeah.
signs of that is coughing, nasal discharge, and fever. More serious cases, your dog might have pneumonia. So if you're bringing your dog, like I said, to the kennel or bringing your dog to the dog park or training classes, that might be a good idea to get for your dog. And this isn't a vaccine. I think it's actually given orally, right? I think it's like a liquid that's given
Oh, okay.
orally.
Have you ever heard a dog
I'm
with
pretty
kennel
sure.
cough before?
Yes.
Oh, it's awful. They sound like a barking seal. Like it sounds like, imagine the worst cold you've ever had where it literally sounds like
Oh,
you're
I haven't heard
bark
a dog,
coughing.
but I've heard of dogs.
Oh yeah, no, it's a horrible sound. Like if your dog's got the kennel cough, like you will know for sure.
Oh.
It's awful. It almost sounds like a kid with like croup, like it's like that seal, like "Burr,
Croup.
burr,
Yeah, I was
burr,"
gonna
like
say that.
horrible, like coarse, like coughing. Like,
Oh.
yeah, it's really sad. My friend's dog had it once, and I was like, I listened to the cough, and I was just like, it was uncomfortable to like listen to this like cough. I was like, oh my God.
Oh no.
Yeah,
Ooh.
yeah,
No, I've never heard a dog with it, but I've heard of dogs. So
yeah.
when I had Wiggum, the breeder where I got Wiggum from, he would kennel his own dogs. So if I were to go on vacation, I could bring Wiggum back to the breeder, and that was something that was required if I were to bring Wiggum there to get boarded, that they had to have their kennel cough meds, and they only last for 6 months. All of
Yeah.
these non-core vaccines or medications, I think are very short term. Like they only last a few months, and I think it's about 6 months.
Yeah. And I was going to mention too, like you said, like if you plan on boarding your dog or taking them for training of any sorts or taking them for grooming or whatever, call it way in advance and ask what the requirements are to bring your dog are,
Yes.
because most
Mm-hmm.
organizations or various businesses or whatever offering those types of services will have a policy that your dog needs a very certain like specific vaccinations to come for that service. So,
Yes. Yeah,
like
and
I
you
had,
might have to provide proof, so get a record
yeah,
from your vet.
yeah, for sure. And like I had friends last year who were planning a trip and didn't think of that. So like they had planned out like this to kennel their dog at a business, and then the week of the business was like, okay, so yeah, bring in this, bring in that, bring in proof of these vaccinations, and they were like, what? Because they didn't have these vaccinations for their
Oh.
dog. And so they were asking us to dog sit for them. So just like whenever you're planning anything like that, always like check with
Yes.
the organization that whose services you're using, because even for grooming, I think most places require that you need at the very minimum like rabies shots,
Oh,
but
yeah.
some others might require others, again depending on how they kennel their dogs, like how close they are to each other. Like different organizations may have different policies, so
Mhm.
heads up. Yeah.
Our next one, this is actually one of the causes of kennel cough, is canine parainfluenza virus. So it's pretty much the same. It's usually mild. Same signs with a hacking cough. Our next one, leptospirosis. So there's a bunch of variants of this one. Some are more severe than others. It could cause lethargy, kidney and liver failure, achy joints and muscles, and vomiting and bleeding problems. And this is the other one. If your dog has an active infection, it can infect humans.
Ooh.
Mm-hmm. Oh, I saw the name for that. It's zootonic. It's a zootonic illness because it can infect humans.
Oh,
Ooh.
Zoolander. That's what makes me think of that. It's very random of me to just.
You don't want your dog to get the Zoolander.
You don't want your dog to get the Zoolander.
And this is transmitted through urine. Again, this one. There's a lot of areas in the States and in Canada that have this. And if you have an outdoor lifestyle or going to these areas that are prevalent in leptospirosis, consider vaccinating your dog for this. And our last one that I mentioned earlier is borreliosis. It sounds like I'm in Harry Potter.
Expecto borreliosis.
Also known as Lyme disease. So it spreads through the bite of an infected tick. Signs are lethargy, fever, poor appetite, swollen glands, and it affects the kidneys, joints, and heart. So, again, like I said, if you have an outdoor lifestyle and you're going to go hiking or go in trails, this would be a good one for your doggy.
Hmm.
And other meds that you're going to encounter along the way is heartworm meds. So this isn't a vaccine, but it's irregular meds. So heartworms are located usually in the heart, and they can travel They can, yeah, they can travel to to the not your but your dog's liver
Yeah.
and kidneys, and they could be up to 14 inches long.
And don't they and this one's quite fatal as well, and isn't that from, like, deer poop?
No, so this one is transmitted by mosquitoes.
Oh,
But maybe
yes.
mosquitoes get it from
Deer, because I it's
yeah.
something to do with the deer, because I remember having a conversation with my vet about it. I think it's
I
like
know
d
ticks I know ticks, feed on mice and deer,
mhm.
but I don't know about worms, like, probably, could be.
I think it's like like I forget what our conversation was and stuff like that because I asked her because like again when you go to the vet all like every vaccine you get it like ramps up and your bill just like climbs
Mhm.
and climbs, right? And so you want to have that conversation about what it is you're doing with your dog, where are you going with your dog, which ones do you need, which ones do you not need, and depending on your vet, you know, some of them push all the vaccines whereas some of them are willing to like negotiate with you and be like, okay, well, if you're taking your dogs to the cottage, like I strongly recommend you get
Mhm.
like this one. And I asked her about the heartworm because I was like, what are the statistics on this? Like, how many dogs have you seen in your veterinarian career with heartworm? And she was like, yeah, like
Very
one.
low.
Yeah,
Yeah.
it's like super low. So I was like, you know, you don't want to take that chance. Like you feel bad, but like it's the same as like winning the lottery. Like what are the chances when you buy a ticket that you're going to buy the lottery? But it
Yeah.
depends on whether you're willing to gamble that with your dog. And, you know, my dogs are running at the cottage where there are potentially ticks, there's deer poop, there's deer, there's
Yeah. Lots of
beaver
mosquitoes.
ponds, there's mosquitoes like everywhere. They like it's insane. Like in the springtime when the mosquitoes all come out and Gibbs comes back from the cottage. Gibbon is a Weimaraner. He's short hair and he's almost like those hairless cats like underneath like his skin is like it's literally like right down to the skin so you can see like every scratch, every mosquito bite, every like so when he comes home in the
Yeah.
spring from the cottage it literally looks like he has measles. Like there's just mosquito bites like all underneath his tummy and everything like that. So I was just like, yeah, like I'll get it just in case, you know, they're getting eaten alive out there.
Yeah. I
So
think this one's very common. Like, I think most people give their dogs heartworm meds.
but
But
again
again,
if
like, if you're living in a high rise in the city and all
yes,
you're gonna be doing is walking your dog on the sidewalk,
yeah,
there's no grass, there's no, like, not a lot of mosquitoes, then maybe you don't need to give your dog heartworm meds.
yeah. And you're going to get a variety of like different types of owners. It's kind of like the anti-vaxxers, like for us
Mhm.
humans and
Yeah.
stuff, right? And people with their dogs might be anti-vaxxers for different reasons. They either think that their dog doesn't need it, or some people simply cannot afford, like they buy a dog but don't have like the income to support all of these extra things that come along with dog ownership because they don't think of that, right? Like it's dogs cost like, you know, at least uh you know, in vaccines alone, like I would say like at
Yeah.
least a couple $100 like a year because you got to take them in, you got to get the rabies at the very least, especially like
Yes.
even in the most suburban of neighborhoods, like you said, there's raccoons and rabbits and bats and mice and
Mhm.
rabbits.
And I mean, if that's the case, if you can't afford it, then maybe, like, you do your research and you know how they're spread, so maybe avoid all these areas.
Yeah.
Like,
And
maybe all you will be able to do is walk your dog on the
and
sidewalk
and there
and
is like and you get the more naturopaths with their dogs too, right? Like
mhm,
so,
yeah.
you know, if there's a lot of people making products like mosquito repellent and things like that, so if you're not typically going to the forest with your dog like every day, but the odd time you go, then you spray them down with there's like sprays that you can get that are like, you know, under like $20. Or there's stuff that people have gone online and shown you how to make like your homemade like versions of this stuff as well. So yeah, it's all up to you and
Yeah.
what you doing with your doggy.
Yeah. Yeah. So I think we can move on to the puppy. Oh, actually, there's the fleas also. There's a topical medication that you can give, and this one prevents fleas and ticks. So it's like, I remember I used to give this to Wiggum. It was like spreading his fur and getting to the skin, and it's like a little squeezy bottle.
Hmm.
I would just like put it topically on his skin, and it's 3 doses. So that will help
Th-
prevent
th-
fleas and ticks.
3 doses, like over what period of time?
I think it's every month,
Oh, okay.
like for the summer months.
Yeah.
Hmm. I'd have to look that up. It's kind of like the heartworm meds. I think they're from June to November here.
Oh, okay. Well,
Yeah.
I remember because when I like we buy tick meds for our dogs again because they're like constantly running in like wooded areas, and it's very expensive. And they just recently allowed the bigger box companies and different stores to sell it over the counter there. Like it used to be that you could only get like the flea and tick meds from the veterinarian,
Mm-hmm.
and
Yeah.
now PetSmart smelling it, PetSmart's smelling it, selling it, and same with Pet
Oh, that's
Value
good.
and a lot of those other ones. But yeah, again, there's like a variety of options when dealing with like
Yeah.
fleas and ticks, and
And
we
depending where you live, you
exact
might have to do it year
the
long.
like even like, and that's the conversation I had with her because I was like, okay, like so just for the summer, and she's like, well, she's like, what they recommend, and it says right on the box is like any month that has a day over 5 degrees, because that's how like the conditions that fleas can survive in, that you should be giving it to them. And we live like in this very weird climate in the city of Ottawa where
Like
like
it was
even
23 the other day, and
yeah,
now it's
23, and now it's like
-1
yeah, exactly.
a day
And
later.
even in, I don't know if you even remember a couple of Christmases ago, like on the Christmas
Yes.
Eve, it was like sunny outside, and
People
my
were
kids were
golfing,
biking and like golfing, and it was like there was no
and the
snow on the
squirrels were
ground.
fat. Did you notice the squirrels?
Yes.
I remember walking Wiggum and I was like, "Holy moly, the squirrels are fat." They've been, like, feeding
Chunky
all this
squirrels.
time.
Yes, exactly. So yeah, you have to read the instructions on these things, or again like just speak to your vet about like what's what.
Yeah, and
um
what they recommend.
and vaccines, like just before we move on from this, just because like I've met dog owners, there's just a couple of more things I want to say on the topic. And
Yeah.
one is know the dogs that you're hanging out with, because again, like, so for instance, I was in this routine for a while, not anymore because my schedule changed slightly with my work or whatever. But I would come home from work, I would go across the street to the park, and like there was a group of 5 or 6 of us that would all bring our dogs to the park at the same time. We'd let them off leash and they'd play with each other. So I was with these same people like on the daily, and so I would just nonchalantly bring up in like a conversation, oh man, I had to take Gibbs to the vet the other day. It's so pricey, eh? Like what vaccines do you guys get? And so that you're creating a
Mhm.
conversation,
Yeah.
but also finding out which of these dogs that you're hanging out with are vaccinated, right? So finding out, and people like, again, they feel differently about like, so somebody, like I said, oh, I get the lepto and I get the stuff, yeah, rabies, of course, and stuff like that, because like I said, my dogs are in the woods constantly. Whereas like some of the other two who just walk their dogs like to this park, like that's the extent of
Mhm.
wilderness they get. um don't get that, but they travel often and they're kenneling their dog often, so they get the kennel cough, like the bordetella, like at each time because of their traveling and stuff like that. And then I have another friend who literally never, her dog never sees another dog ever. She walks her dog twice a day. She goes down like a somewhat like wooded path or whatever, but like never off leash. So she has her dog on leash all the time. And she went to a veterinarian who said, then yeah, you no need to vaccinate your dog. She cares for her own dog. She grooms her own dog. Her
Yeah.
dog doesn't see any other dogs. So as a puppy, yes, was vaccinated against those core things because those are absolutely important. But in terms of the non-core ones, like the kennel cough, like the lepto, the bordetella, like all that stuff, she didn't need to, and he recommended not doing it, because he said the less you can vaccinate your dog, the better.
Yeah.
So,
Yeah.
it all, everybody's got a different view on it. Um, Again, there's many different reasons, but I would say my recommendation is to know the dogs that you're hanging out with and what vaccinations they have. and
Yes.
um and yeah, like pick and choose, and depending on how your vet is, if you find that they're super pushy and and getting you to vaccinate for every single thing and not listening to you and your dog's lifestyle, I would switch vets.
Yeah.
And that's all I got to say about that.
Yes.
I don't want to come across as like a veterinarian hater on here. Like, I hope I don't give that impression
No,
like in these episodes. But it's it's the same as like any other thing. There's good ones, there's
it's how
bad
it
ones,
is.
and it's yeah, exactly. And it's expensive. They are an expensive service.
They are.
So
I really liked my vet because they really like discussed with you like what you wanted and what they recommended, and it was just like, okay, step one, we're going to do this, whereas other vets would be like, we need to do all of these things right now,
yeah,
and then it's very costly.
y'alls.
All right, on to puppy vaccination schedule. So if you're getting your puppy from a breeder, and you're getting them at 8 weeks, they should have their first set of vaccination for distemper and parvovirus. And then you have 3 boosters, and they should be about separated. There should be about 4 weeks in between them. So around 12 weeks, you should give a they should your dog should be receiving a booster for distemper, adenovirus, and parvovirus. I also have I've depending on which website you look, the puppy schedule includes different things. So this one that I saw, well, I looked at a few, but the one that stood out the most, that I kind of agreed with the most, had para-influenza. So I don't know if I actually agree with that one, but
Yeah.
as one of the required vaccinations at 12 weeks. So distemper, adenovirus, and parvovirus for sure. At 12 weeks, this is the time that you could give your first lepto and bordetella vaccines, which last only about 6 months. And your puppy could be getting deworming at this point because your puppy gets worms from the mom's milk,
Hmm.
and they need to be dewormed for that. And then at 16 to 18 weeks, you get again your required boosters. So again, distemper, adenovirus, and parvovirus. They could get lepto again, and this is at at 16 weeks they could get their first Lyme disease, depending on what you're doing with your puppy. But I really feel that at 16 to 18 weeks, you shouldn't be taking your puppy like on a trail or hiking.
Yeah.
Yeah, and they would get dewormed again at this point. And then you get to your first year booster, which is again distemper, adenovirus, and parvovirus. And then depending on your opinion, what you believe in, what you're deciding to do for your dog, some recommend getting these boosters every year or every 3 years. And I didn't talk about rabies.
Oh yeah, the rabies.
The rabies. Your dog should be getting their first rabies shot around 16 to 18 weeks. And then every 1 to 3 years. And this depends on provincial laws. So, depending on where you live, I think where we are, is it every year here? I can't remember.
No, it's every I think 2 to 3.
Okay.
I think it's 3 even. Yeah, I think it's 3.
Yeah. And even the other boosters, depending on what you decide to do, you can get them every 3 years. I know my vet recommended every 3 years for Wiggum.
Hmm. I think my
Hmm.
my guys are 3 years too.
Yeah. I think
My
every
guy
year
and
is
girl.
too much.
Yeah.
You can get titers done also
Hmm.
to see the level of antibodies in your dog's blood and then decide
Yes.
from there.
Hmm.
But that's another cost. But
Yep. Yep.
yeah.
Sometimes they'll recommend that. Check and see where they're at. See if they need a little
Yeah.
boost.
So, yeah, your puppy should be getting, they should be getting 3 boosters with 4 weeks in between. And then they get their 1 year booster. And then after that, depending on what you decide to do, every 1 to 3 years.
Yeah.
And look at the law for rabies in your area.
Absolutely. And I would say, like, each time before going to the vet, whether it's a checkup or whatever, read through these things so that you know what they are again. Because again, these, you're going to get to the appointment. They're going to say, all right, do you want like this vaccine, this? How about we give them this? And how about we give them that? And if you're like, oh, yeah, what is that one again? And you're like, not sure, do a quick read through before you go to the vet so that you can
Yes.
negotiate a bit more with your vet, and you'll
Yeah.
know like what you'll need. Okay, well, we're not really doing this, so like we don't need that. We're not kenneling, so no, I don't want that. Like, and that kind of stuff. So
And
you
I know
don't
my
walk
vet
in.
always gave a vaccination record
Yeah,
after every new vaccine. So you can ask for that, and then it's better to keep track
yeah. We
of
my
what was
vet
given where, because that can get confusing, especially if you have more than one dog at their different ages.
exactly. Our vet gives you a little digital chart like with a password so that I can, like, let's say I wanted to take my dog to the groomers next week or whatever, I can log on to Gibbon's chart and I can print off any of the records that they have.
Ooh,
Yeah, it's like
it's
a
like
little,
my chart.
I was gonna say it's like a little my chart for my doggies. Little snoot chart.
Snoots.
All right, so are we gonna move on to some of the most common problemos?
Yes.
All right, so um, I found in a couple of different sites the top reasons why people take their dogs to the vet. So came up with a list, and I'm gonna go through them one by one. Um,
Mm.
so the first, or number 10, is cancer. Cancer. Now, looking at your
Mm.
dog, how can you tell if they have cancer? But like again, if you see like a growth, if something's changing and that kind of thing, and you're starting to get freaked out or whatever, like growths is like another one of the things down the list. So I'm kind of like killing two birds with the one stone here. But if you're starting to notice a growth of any kind, I would take them to the vet because the vet's going to be able to do a quick assessment and, you know, um, just going by feel, get might be able to get an idea of what it is. Now, obviously, you can't without proper testing and stuff like that. But as an example, Gibbon got porcupined recently up at the cottage. We took him in for the super expensive dequilling of the face,
Mm.
and when I went to pick him up, she said, "Oh, did you notice there's a growth on the side of his face?" And I always thought it was like his cheek muscle because there was like one on either side of his face, and on one side I guess it was the muscle, but on the other side there's a growth in it, and it's about the size of a pea. And she had to feel at it, and she said it feels soft, it's mobile, like you can move it around and stuff, which tends to make one believe that it is not cancer. So she said just keep an eye on it, and it could even be an infection from one of the quills, so watch them on the antibiotics and see if it decreases, and we can go from there. So some people, like, depending on, again, like how quick you are to take your dog to the vet and stuff like that, may try stuff at home for that. I remember I had a friend with a cat who had a growth on his arm. It was getting bigger. It just seemed like um, it was like a little pocket of something. So we had discussed, like, we work in the medical profession, taking some syringes and stuff like that from home and just like sort of draining it ourselves. And I am sure glad that we did not, because it ended up being like a nasty sarcoma. And when they biopsied it at the vet, it like flourished and opened, and she ended up having to remove her cat's arm. So with growths, I wouldn't go experimenting with any like home stuff.
No.
I would take them to the vet and let them like handle that stuff. And same with cancer, like you don't know, like, unless you're a vet or you have somebody who works in the field, you don't know what's cancerous, what's not. So again, cancer, growths, anything like that,
Yeah.
I would be taking them in. Number 9 on the list is cruciate ligament tears and surgeries.
Ooh,
So
youchies.
um there's been several times where I know I've talked about my father several times on this show, but he takes my dogs regularly up to the cottage, and there are no rules, and there is like no no boundaries at all. And they come home from the cottage literally limping because they have run so much. Like it's like they cannot like move, like, again, and especially as like our dogs get older, that becomes harder on their muscles, right? So I don't let them like run as much when I'm up there, but My dad is an untrainable dog and lets them do whatever they want. Um, so my feeling on that, and again, like this is gonna be individual to individual. Like another friend of ours who owns dogs, like when she notices her dog is limping, she goes straight to the vet right away. And again, it depends on whether you have insurance or not. Like it depends on where you are at with your income and how much you're willing to spend on your dog. But I will let my dogs go several days. Can you hear them woof woof woofing in the background?
No.
They're barking, given it. There must be a
They're
big
like, I
one of
know
those
you're
big
talking
fat
about
squirrels out
me.
there. Yeah. I will let them go several days to watch to see if it will resolve on its own, because like most of the time if they rest, um it gets better over like I'm
Yeah.
good to give it a good 2 or 3 days, and if I see that they're not progressing or it's not getting any better, then I might go take them into the vet. I might like massage them like a little bit, like try to massage like their
Yes.
muscles where they're limping and stuff, just to give them a hand. And also, if your dog is starting to age and you're noticing that they're a bit more stiff, especially after a lot of activity, I would start putting glucosamine in their food. And
Yes.
glucosamine you can buy from any pharmacy. It's like cheap, cheap, cheap. You sprinkle it on top of their food and they don't even notice. Or you can give it in pill form, depending on how good your dog is at taking pills. I've had like the worst of the worst and like the best of the best in terms of pill takers. And but I would highly recommend glucosamine for once your dogs start getting up there in age, and especially just keep an eye on them and see like, oh yeah, you start to notice as they get older, like, oh, they're getting a bit stiff there, like, they.
Yeah, and take it easy. Like if your dog,
Yeah,
and this is like might be obvious, but if your dog is limping, then like take it easy for a few days and see if it gets better. Like don't bring your dog to the dog park or take long walks.
exactly, or take them on your like 25-kilometer run because you're getting ready for a marathon.
Yeah.
You know what I mean? Like, yeah, give them a break. Like when they come back from the cottage limping, like I don't even take them out for a walk for like the next 3 4 days until they start sort of like sprucing up
Mhm.
again. And I try to tell my dad to take it easy on them. Don't let them run so much, but they have their own thing going, and that's why they're like super excitable whenever my dad comes, because they're like, yay, it's Christmas, no rules at all.
Woohoo.
But yeah. All right, number 8 on the list is allergies. So,
Ooh.
allergies is also going to touch on some of the other things on the list as well. Allergies can come in many different forms in dogs. And again, it's just like humans. Like when we get nauseous and vomiting and diarrhea, it could be a variety of things. It could be your digestive system, it could be an allergy to something that you've eaten, it could be a very specific thing going on in your body. Maybe there's something wrong with your liver, maybe there's something wrong with your gallbladder, maybe it's your appendix, maybe like there can be a variety of issues.
Yes.
So you kind of have to sort of guess, and that's why it's like obviously good to take your dog to the vet, but again, if you can troubleshoot a couple of things first, you may not have to. So if you've introduced a new food and now all of a sudden your dog's like vomiting and has like runny eyes and a runny nose, or if like it's allergy season and you're noticing like you take your dog
Mhm.
out in the grass and they come in and they're sneezing, 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 sneezing and have discharge from
There's
their nose and stuff
itchy.
like that, and they're itchy and stuff like that, you watch out for things like that too. It could be that also that they ran into something. If you're letting them go in a wooded area, maybe they ran through some poison ivy, maybe they did something like that. So like just keep an eye on things. And poison ivy, I would say, is like fairly obvious, like they're gonna have some like really nasty
Yes.
like skin stuff going on. But you know just take a moment to think through, okay, what have we changed, what were they doing, when did this start, monitor and try to like troubleshoot a couple of things and see if it's making any difference. And then again, if things are not getting any better or they're not clearing up, I would go ahead and um, take them on into the vet.
To the
Um,
vet.
so the number 7 on the list, I know, did Wiggum have some allergies before we move on?
Yes, Wiggum had, I don't even know what he was allergic to, but it was year round. I'm thinking it was probably his food because I
Mm,
did try to switch his food quite a few times, and I finally switched him to, I think it was a grain-free food, and that significantly helped, but it didn't completely go away. So yeah, he did have some allergies,
Yes.
but I don't think they were seasonal or
Or
anything.
anything like that. It's
Yeah.
yeah, it's hard to troubleshoot, right? So number 7 on the list is urinary tract infections. So
Mm.
this is like I've heard this a whole bunch of times. It's a common thing. It's like your dog's fine, they're doing great, you're going about your business, life is good, you love your dog, and then all of a sudden you start noticing they're having accidents around the house. You come home, there's a big pee in the kitchen, there's a big pee outside their crate or something like that, and people are very quick to anger, like, what the hell did you do, man? Like, we had such a good thing going, like, what's your
Yeah.
problem? And they think it's a behavioral issue. But if you notice your dog is having accidents and they don't normally, chances are it's a health issue.
Yeah,
And
something's going on.
something's going on there, and I would just keep an eye on it, and again, make sure like they're drinking lots of water, um that type of stuff, to see if maybe that's it. Maybe you forgot to fill the water bowl or something like that, and like they're just dehydrated, and now they've got like a urinary tract infection. You can try that. Monitor their drinking, watch how many
Yes.
times they're
Yeah.
going outside to pee. If you're noticing it's like more frequent and that's the reason for the accidents, again, you're going to have to take them in because they're going to need antibiotics
Yeah.
of some kind.
And they might be mopey.
Lethargic, a
Yeah.
little like hanging around, a little like
Mhm.
a little bit more licking of the genitals than normal.
Yes.
Just sort of keep an eye on them and see what's going on there. Next one on the list is growths, which I kind of like mentioned with cancer. Like if you're noticing a new growth somewhere, if you're noticing that it's getting bigger, that sort of thing. I'm going to give another example of this. So, and this is so hilarious too. It's like it seems to be a trend with my dogs. So when Becky got porcupine, several years,
Oh.
I've never even saw a porcupine at our cottage for like literally in all my life. And
They
then
obviously have.
in the past 3 to 5 years, they've just been hitting up like each dog of mine. Luckily, it seems that they learned their lesson after the first porcupining and they don't go back, because Becky was the first to get porcupined when I had Becky and Scraps. And then, literally a year to the date, Scraps got porcupined. And then we didn't have a porcupine issue forever. And then this summer, Gibbs got porcupined and Becky was with him. So, like, Becky was with both, like, Scraps when he got porcupined and then with Gibbs when he got porcupined. So I know Becky's learned her lesson.
Becky's like, I told you not to.
So the so Becky got porcupined first. We got her dequilled, no issues at all. So like I said, the following year, she's with Scraps. Scraps got porcupine, and Scraps was much older, so the general anesthetic was super hard on him, and it's very stressful because it's so painful on them, and you just feel so friggin' bad for them. And so we had taken Scraps in. We were fussing over Scraps all day long. When he came back, he was so out of it from the general anesthetic. So I was trying to get him to drink and trying to get him just to like lay down and settle. And I am fussing. And then right before I went to bed, I went to go say goodnight to Becky. She was sleeping on the couch, and I was like, God, I should check her too, just in case, because she was probably with him, and see if she has any quills on her anywhere. So I do a full body check. I go down her body, check her tail, check her legs, like everything. I open up her mouth, and she has this mass in her mouth. And I was like, what the heck? So I was like, and it looked like it was like an infected tooth. And I was like, oh my God, I just spent like so much money at the vet. And now an infected tooth, that's going to be like thousands of
Oh,
dollars.
yeah.
I was just like, no. So I was like, crap. So the next morning, first thing I do is call the vet. I take Becky in and he squeezes on it. And I thought she was going to like jump through the roof or like bite off his hand or whatever. And she didn't budge like an inch.
Ooh.
So I was like, oh, and he's like, okay. So he's like, this isn't an infected tooth. And I was like, yay. And he's like, but what it's called is an epulus. So an epulus is either a cancerous or benign growth that grows in the connective tissue of the jaws certain breeds are prone to it. And because she's a mix and we don't really know what she is, who knows if she's one of those breeds. But anyways, she has this massive growth like that's covering a couple of her teeth now. So it started at like half a centimeter, but it was like nothing. He's like, we could either do the surgery, but if they find out that it's cancerous on the inside, the treatment is you remove the jaw that it's affecting. So it's on her
Wow.
lower teeth teeth. So I was like, okay, well, she's young, she's healthy. I would have never have even seen this on her face if I wasn't going looking for like porcupine quills. Eventually, I would have
Yeah.
seen it, I'm sure. It's not bothering her. She's eating, she's running, she's healthy. I'm not going to go doing the surgery because if it is cancer, then we put her down. Like what? She was like it's 6 at the time, like 5 or 6.
Yeah.
So I was like, no, let's wait. Let's keep, once this starts affecting her, then we'll go to remove it. So even now, so this was like several years ago that we found it. Now it's grown. It's at about like a full centimeter now. But again, she eats no
It doesn't
problem.
bother her,
She
so
runs, she runs everywhere. So I'm not gonna pay for the surgery to do it because there's a chance that the surgery might be bye bye Becky.
yeah, because like you wouldn't
Yeah.
remove a lower jaw.
No, I'm not gonna remove her lower jaw and
No.
put a
Like
feeding
what would
tube in her face,
happen?
like,
Yeah.
yeah, that's what they do. They would put a feeding tube in place. I'm not gonna do that to a
No.
dog. You know,
No.
some people do, that's fine. Like, I'm not because it's expensive and I don't wanna be taking care of a feeding tube on a dog. Like, and it's not fair to her. You can't explain to them, like, what's going on, right? You can't be like, "So, we're gonna take off half of your jaw, okay, Becky?" Like,
Yeah, you won't be able to eat.
no, and
One of their
it's
many joys.
exactly. Like, oh, it's just so sad. So, anyway, so Becky has this growth on her mouth, and until it starts affecting her day to day living, we're not doing anything about it. And some people feel that way about like several different growths, but like, again, like cancer comes in many different shapes, sizes, forms. It grows at different
Mhm.
rates. So if you're noticing a growth on your dog, like I would monitor it because if it goes from like 1 centimeter to 8 centimeters in a matter of like 2 months, you might want to get that removed.
Yeah.
But otherwise, you can play it by ear. So number 5 on the list is pain. So pain is one of those tricky things to notice in dogs.
Yes, because they
Uh,
can't talk to you.
they can't talk to you, and again it manifests in like different ways. One of the most common ways to tell if your dog is in pain is panting, but sometimes they pant because they're
Mhm.
hot and stuff like that. But if you notice like your dog is like licking and licking and licking and licking and licking and panting and panting and panting and panting, like Scraps was like that near the end of his life because he was like just arthritic
Yes.
like everywhere and he was in a lot of pain. You can go to the vet for some like vet drugs, but there's also a lot of things that you can use that are safe for animals. So Tylenol is safe for animals. It
Ooh,
is. I'm pretty sure.
I didn't know that.
It is. I don't think they recommend giving Advil because Advil
No.
is like a blood thinner and so like if there's something going on like internally with them, you don't want to make them bleed more and it's a little bit harder on their stomachs as well so you might induce vomiting and stuff like that, but I'm pretty sure Tylenol is safe. I know Gravol is safe for dogs as well.
Mhm. Yeah.
You know, if they're having like, you know, if they get motion sick in the car when you're driving up to the cottage and they're vomiting and drooling like crazy and stuff like that. But anyway, so pain's like a difficult one. So again, like Scraps, when he was older and arthritic, like even like standing up, he'd be like
Oh.
like standing up and like he
Ah.
would just yeah, and he would get up and like stretch it out and be like oh, and like finally like standing up and it was just like oh buddy and just like one thing I forgot to mention too, like we were giving him glucosamine when we started noticing he was a bit more stiff and a bit more pain and stuff. We started the glucosamine that made a significant improvement with him for quite a while. And then age as ruthless as it is continues
Yeah.
its deteriorating path and he continued to get like worse and worse where it was like literally like very difficult for him to like stand up from a laying down position. So there's this like arthritis medication called Metacam that you can get for dogs and it is $200 a bottle. And I had a friend tell me, like, she was like, so look, if you look at Metacam and you look at this medication for humans called Mobicox, it is like the exact same ingredients, exact same. And Mobicox is used for inflammation and arthritis and that sort of thing too. So I had my doctor write me a prescription for the Mobicox, and
Ta-da.
I cut it in half and I gave it to Scraps, and again, like huge difference. It's like there was a
Yeah.
spring in his step again, and for $11 rather than $200. So I mean, if money is an issue for you and you're looking at other ways to sort of handle what's going on with your pets, like when it comes to meds, like obviously there's certain things that like you can't go substituting because there's stuff that's safe for them and stuff that there isn't, but go online and do a bit of research. And that's I think that's all I'm going to say about that. But yeah, pain is a tough one
Yeah.
for
And I
the
think,
dog is.
yeah, if you're touching your dog and they react differently, if you get to a certain spot, that might be because it's painful,
Yeah. Oh yeah, for sure. Like if you went to touch Scraps in like a certain spot, like he would like not like
like
snap
jerk
or anything,
or,
like yeah,
yeah.
jerk or like yelp or that sort of
Mm-hmm.
thing. The next one on the list is eye conditions.
Mm.
And I'm going to address these both together kind of. Number 4 and number 3 are eye conditions and ear infections. So eye infections, again, you're going to notice that's fairly noticeable. They're going to have discharge like goo coming out of their eyes. They're going to like uh you're gonna like those, it's so gross, but they get the massive like eye boogers sometimes, like they're
Yes.
green and it's like really filling up and covering their eye. um I personally would initially try to treat that one at home. Polysporin drops are
Yes.
okay to use on animals.
Mm-hmm.
um the other thing you can do is just take a warm cloth and wipe it away like every day and try to keep the warm cloth on their face if they can tolerate it. Like warm compresses help for humans, it helps for dogs too. Try to manage it a bit that way. If it's not getting better and it's getting worse, it could be that they need some heavy duty antibiotics, and by all means take them to the vet. And that's all I really have to say about eyes, unless you notice again like a huge growth or whatever that could be causing
Yeah.
it. It could be that they have something in there too, like if they were running through the woods and got like a stick in there or like a whatever, and like eyes just like start to drain, right? Because like if they get infected, it's
Mm-hmm.
like bleh, and they just like
Yeah.
totally um
I know
and
Wiggum had a growth in his lower eyelid, one of his lower eyelids, and I think it was, I can't remember what the right term is, but it was like a pocket of something, and then it would get big and it would actually fall, and then he wouldn't have a growth for a while, and then it would come back.
oh, okay,
Yeah.
like almost like a skin tag but like around the eyelid.
Mm-hmm. Yeah. A recurrent skin tag, but it was like inside.
Weird. And
Mm-hmm.
I know my sister's um little wiener dog Pogo gets like blocked tear duct like fairly often too.
Oh, yeah.
So again, like I would, if you start noticing like any discharge, like as soon as you start noticing it, I would start with those warm compresses. Maybe give them like a little saline spritz to the eye to clear things
Mm-hmm.
out. Try to do that like a couple of times a day, and again, if it's not getting better, then take them on into the vet. And then as I said, number 3 there was the ears. So ears and all these different things, like especially when you get to like eyes and ears and stuff like that, there's like very breed specific um things that can happen with like an animal, like certain breeds that are more prone to that. Apparently wiener dogs
Mm-hmm.
are super prone to like blocked tear ducts and stuff like that. And as well as when we're addressing ear infections here, all of the hound dogs with the big floppy ears
Yes.
are way more prone to ear infections.
Yeah.
um
Because they're not open to air
yeah,
and everything stays
stays
and
in there and can sit. And
festers.
yes, and when I bought Gibbon from the breeder, like he showed me, he said definitely clean their ears, like you have to clean their ears. And I'm not going to lie, I'm not super on top of cleaning their ears. I was in the beginning. There's different solution. They say not to use an alcohol solution on the ears because it dries things out too much and you might do a bit more damage to the ears. And one of the best, most cheapest way to clean your dog's ears is apple cider vinegar, everybody.
Ooh.
So get like a cotton swab. And my vet showed me how to properly clean the ears, and it sounds like super gross. And I'm not going to lie, it is super gross. But you can lift their ear and go down to like the second knuckle of your finger. Like that's how
Yes.
deep you can go, and you want to swirl stuff around in there. So you don't want to go like pouring like open pouring like apple cider vinegar into their ears or any solution that you're using. You want to like super wet like a either a cotton swab or cotton something, and you want to go right down in like really move it around and then like pull
Mhm.
everything up. I wouldn't recommend using q-tips or anything like that, because
Oh, no.
obviously if the dog moves around or switches his head, now you're gonna like damage like the eardrum. But like it's gross how far you can stick your finger in their
Yeah.
ear. Like, and they don't even, and again, like I had Gibbs from a pup, so I always like every day I would do like a veterinarian exam on him. I would touch his ears. I would like go try to touch inside his ears with my fingers. I would touch his paws. I would touch his tail. I would like literally, I know this is like very, might sound like I'm violating my dog, but these are the types of things you have to prepare them for. And I've gotten
Yeah.
compliments every time I go to the vet because he's so calm, because he's used to us to like
Mhm.
manhandling him all the time. And he was really good about ear cleaning. Like he knows to sit and stay, and it might be a bit uncomfortable, but we pull all that stuff out of there. But ear infections, you will be able to know because they smell
Oh.
so bad. Oh,
Yes.
they can get like yeasty ones. And
Mhm.
Becky, I've smelled her ears a couple of times. They start to like really stink. So
They
if you
do.
if you're noticing like an odor, you get out that apple cider vinegar and start going to town, because you want to avoid the vet visit and the examination fee and the antibiotic fee and the
Yes.
fee
And
fee
I think
fee.
another common sign is if they're shaking their head or they have like a head tilt.
Yeah, they're really moving it, like tilting it to the side. You can see it on their face. They like squint and they're like, "Eh," and they're scratching it, and they're like, they even make like the noise, like they're like, what they
Mm.
scratch, 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 and that kind of thing. Yeah, I think that's all I got to say about that. And which brings us to number 2 on the list, which is stomach issues. And again, that's like the most common thing, right? Like, how many times have
Mhm.
we said vomiting and diarrhea on this episode? Maybe we should title it that. Episode, I don't even know what number of episode we're on now. Is it 9?
I think
9?
we're
10?
10.
10?
Yeah.
Episode 10, vomiting and diarrhea. But stomach issues, and again, just think about where you've been, what your dog's been doing. Did you change your food? Did somebody give them a weird treat? Did they get into something like the garbage while you were out?
Yeah.
And so this is another quick little home remedy. So if you physically watch your dog eat something that is dangerous or harmful to them, you can take a tablespoon of peroxide, you can mix it in with yogurt or something like that, and feed it to your dog, and they will vomit within minutes. So
Yes.
if you just watch them, like if you like hear him rustling around in something and you walk into the kitchen and he stole like a chocolate bar like off the counter and is like like 3/4 of the way finished this chocolate bar, go grab the peroxide, mix it up, give it to them, and they will vomit it all out. Now,
Yeah.
if you're unsure
Mm.
of when they ate it, you can still give it a try if you want. They're just going to vomit. But if you don't know when they ate it, you're just going to make them vomit for no reasons, because once it's kind of way down in there, they're not going to necessarily vomit it out. And depending on what they ate and how harmful it is to them, you may be going to the vet.
Yes. And we
Yeah.
should have an episode on all those toxic and poisonous foods,
Yes,
like
that is a
human
good
foods,
idea. Yes.
and
Yes.
plants.
Yes, and frogs, and like if they eat toads, like apparently that's like super like poisonous to them.
Oh, really?
Oh god, yeah. It makes them like sick.
Mm.
So same thing, like another I always like to use examples. So my friend Mark used to have a German short-haired pointer. He has another one now, but Molly was his previous uh German short-haired pointer. We used to dog sit quite frequently, so me and Molly were besties. Us girls used to hang, and I remember Mark coming to work one day, and he said, "I'm really worried about Molly." And I said, "Why? What's going on?" And so they have a cottage too. They got back from the cottage, a lot of, are you ready for it? Vomiting and diarrhea.
No way.
beaucoup de vomiting and diarrhea. And she wasn't eating, and she was starting to lose weight, like to a scary point. And so he thought that she was poisoned, like, and that she had eaten a toad or something. Like, they're in a very like swampy sort of like area. He was like, God. So he gave it a good like 4 or 5 days or whatever. But that's when like she wasn't eating, she wasn't keeping anything down, she lost like so much weight. And he was like, oh my God. So he took her into the vet. So they couldn't find anything like painstakingly obvious at first, so suggested like several blood testing. And lo and behold, she had the super um I think rare for dogs, genetic disease called Addison's disease. So all of her
Mhm.
electrolytes and everything were all out of balance, and they started her on meds, and then no problem, she gained the weight like right back, and everything was all good. So you just never know, right? And it's difficult because like you love these family members, but they can be expensive at times. Like,
They
it's really
can.
really pricey, those vets. Like, God, like, thank God they're there, but oh my God, like, everybody just like, it's like dread. It's like taking your car in when you know something's wrong. You're like, God, is this going to cost me like $200, or is this going to cost me like $5,000? you know
Yeah.
it's like very daunting. So yeah, with stomach issues, again, like, just question like what changes have been made, what they could have possibly eaten, try to push the water on them if there's a lot of vomiting and diarrhea, and see where it goes from there. And the very last one on the list, which is the number one apparent reason why people take their dogs into the vet, is skin conditions. So you start noticing spots.
Mm.
So again, this could be allergies, this could be mange. So I'm going to talk about mange
Hot
really quick.
spots.
Yeah, mange is like, if you Google pictures of it, it's like a really nasty skin condition. So you're going to notice that they're itchy, like extreme itchiness. You're going to notice redness and rash. You're going to notice thick yellow crusts, hair loss in the areas in which they're itching.
Yeah.
Sometimes it's like yeasty. There's like a thickening of the skin. Like, when you look at these like dog rescue videos, you see that a lot of the time. It's like
Oh,
their
I
skin just
know.
looks when they're covered in it, right? Like, that's like an extreme um sort of thing. And mange is actually like, it's from mite. So there's a mite on the skin, and they're going to need like treatment for it. So like, you might need to clip the hair, you might need medicated shampoos for them. And to tell you the truth, like, and depending on how bad it is, like, you might need mite eradication and control. So I'm not sure if that stuff is veterinarian sold only, or if there's stuff that they sell over the counter for that at like pet stores and stuff. But yeah, check that out. And when talking with a couple of other friends, there's a variety of different things that you can do for dog skin. So, like I said before, you can throw stuff into their food. So, like, if you put a raw egg on top of their food, that's really good for their coat and their
Mhm.
skin.
Yes.
If you put
Those omega 3.
those omega 3s, and you can also use coconut oil, like a teaspoon of coconut oil, throw it on top of their
Mm.
food. Coconut oil you can also put on their skin. Are they going to lick it off? Absolutely. But is a little bit of it going to get in and maybe help them? Maybe. Give it a
Yeah,
try.
I think it's like honey. It's very good. It
Yes,
has
and honey.
properties that are
Exactly. So if you want to go au naturel, you can put a little bit of honey on it. I know that sounds weird, and yes, they are going to lick it off, but try, like, if you have them trained or whatever, you can just like have them lay down, put it on them, and then just wash them, and try to see if you can keep them quite a bit from licking it, so it can like set in a little bit, and then be like, all right, fine, go to town. But so those are some things that you can try for the skin. So yeah, hot spots and stuff like that. That usually those are like very temporary. They'll pass like on their own. But if you're noticing certain things are getting really raw or really itchy or expanding, and they're
yeah.
losing quite a bit of hair, you might want to start stepping in and trying a couple of these home remedies first. Also for cuts, scratches, if they get into a fight, or like I said, Gibbs comes home from the cottage and you can see every cut and scratch along his legs. I keep a look at them to see if they're getting increasingly like red or itchy, or you might start to see some green pus and stuff like that. Then you want to start definitely treating it topically with something. Another good natural thing to have in your cupboard when you have doggos, and even for humans too, I think, is the stuff called colloidal silver. You can buy it from
Mm.
any pharmacy. It's like in a liquid form, and putting that over cuts and scratches are amazing. And you can buy like dog bandages online for pretty cheap. So you can try covering it, put a bit of gauze, and then just cover it up. See if your dog can tolerate that without chewing it off, which they tend to do
Yeah.
like most of the time, but see if they can at least keep it covered for like a little bit. I would just take a gibbon, I would put him like on his dog bed and have him sit there and just be like like whenever they go to
Yeah.
lick or chew at
Just
it,
watch them.
yeah, and just watch them. So those are some of the things you can do. So that
Good.
brings us to the end of our list. I can't think of
Yeah.
anything else I wanted to say on that. There's just like um you tend to panic when you notice something like really wrong, but just take a deep breath and take a moment to like research some stuff that you can do. And I would say give it a few days to see if it's going to resolve on its own. And if obviously if you notice things getting like increasingly worse like at day 2, then don't wait like to go to the vet or whatever. But there's a lot of stuff that, like, dogs are pretty resilient animals, they heal pretty quickly like on their own.
Yes.
And if you can try to help them a bit at home, like sometimes it resolves on its own and you save yourself an expensive vet visit.
Yeah. And know
Yums.
your dog, like know your dog's character, because like you said, they're very resilient. And I think sometimes it takes a lot for them to show that they're in pain or
Hmm.
that something is wrong. So assess your dog frequently enough so that like you can notice those bumps or those red spots so that you can take care of them as quickly as possible and not let them fester and grow into something more serious.
Yas.
Because, yeah, dogs don't really show that they're not well until they're very not well
Yeah.
sometimes.
Yeah.
And I think that's a wrap.
That is a wrap. So we'll see you next time on Let's Boop Snoots.
Let's boop snoots. Bye bye.
Bye bye.